Welcome back, caregivers. If you're new to me, I'm Jennifer, a licensed speech pathologist who is on a mission to help caregivers learn and succeed with taking care of their loved ones at home. In today's video series of What's Wrong with Mom, I will be talking about why eating becomes less frequent for those suffering from dementia and ways you can help. As a caregiver, one of the most important concerns you have is that your loved one isn't suffering. That's why it is crucial to learn about dementia and how it normally progresses so that you can make the best, albeit one of the hardest decisions when it comes to end-of-life care and food. To start, let's again pretend that I am your loved one with dementia. And because I have dementia, there are a lot of things that can cause me to have a poor appetite or stop eating altogether. Let's run through the top 8. I'll go over the potential reason first, and then I'll talk about how you can help. So number 1, physical difficulties. I may have trouble chewing and swallowing my food, which causes me to be afraid of choking. Or I might just be constipated and I don't want to put anything else in my stomach. So what can you do? Well, first make sure that I'm not showing any signs of difficulty chewing or swallowing, like coughing or choking, clearing my throat often, grimacing when I eat, or even spitting food back out. Eating and drinking is a complex process that involves control in the brain and strong muscles in the mouth, neck, and throat. So if I'm struggling to eat, I will need the help of a speech therapist to find out exactly what's going on. Number 2, pain. Maybe I hurt. Maybe I have tooth decay. Maybe my dentures don't fit right. Maybe I have sores in my mouth. Or maybe I just hurt all over. What can you do? Well, first make sure I don't have anything wrong with my mouth, like sores or ill-fitting dentures, or anything that might make eating more difficult. And please, please help me keep my teeth brushed and my mouth clean. If I start developing bacteria buildup, all of the food that I'm eating will taste awful. Number 3, communication. So I'm gonna have trouble telling you things like, I'm not hungry right now, or I don't like this food, or this is too hot. And as my dementia progresses, I may stop being able to remember what to do with my food. So I might not know how to bring the food to my mouth, or once it's in my mouth, that I need to chew it. But I'm not going to be able to tell you these things. So what can you do? Well, keep an eye on me when I'm eating. Make sure that I seem to like what I'm eating, and then make sure that I can use the right utensil to get the food to my mouth. If I seem to be holding the food in my mouth for a bit, or take a long time to chew, it may be time to try a modified diet. Number 4, depression. This is a huge problem for people like me. A lot of the time, I feel sad, lonely, and hopeless, and I'd rather sleep than eat. What can you do? Talk to my doctor about some medication. There are a lot of different kinds out there that can really help me out. Number 5, concentration. So I may not be able to keep my attention on eating all the way through my meal. I can get started, but then I forget what I'm doing as we go along. I may even forget to use the correct utensil to eat the food that I have, especially if I need more than one, like a fork and a spoon. What can you do? Well, to make sure that I stay alert, keep me entertained with soft music or small talk. But careful though, because if you give me too much stimulation, then I might get overwhelmed and want to stop eating. Sometimes just eating with you can help keep me on task, because I'm going to do what you're doing. Number 6, medication. Unfortunately, I'm probably on a lot of different medications. These can make me feel hungry, or they can leave me without an appetite at all. What can you do? Again, talk to my doctor about this one. Maybe they can change the pills to some that won't affect my appetite quite so much, or maybe they can add an appetite stimulant if it's appropriate. Number 7, physical inactivity. I may not be very active during the day anymore. No activity means no appetite. What can you do? Encourage me to get up and move around a little bit if I'm still safely able to. Even just a little movement can help stimulate my appetite, or even help with my bowels a little bit, which will always make me want to eat more. Number 8, food preferences. Do you know if I like my foods hot, cold, salty, or sweet? What I used to like may not be the same kind of foods that I like now. So what can you do? Well, first understand that dementia tampers with taste buds. So try changing the food and drinks that you're offering me if you see that I'm not eating certain things anymore. Maybe my taste buds just want something different now. Usually, something extra salty or sweet will do the trick. Now, caregivers, one really important thing to remember is that even though I have dementia, it doesn't mean that I'm not like you in a lot of ways. I have thoughts and feelings, likes and dislikes, even if I'm not able to tell them to you. So as my care partner, take a step back and ask yourself why I may be reacting the way that I am. And also remember that your loved one's reactions are not a deliberate attempt to be difficult. When your loved one begins to enter into the later stages of dementia, their body is going to start shutting down, and they're no longer going to require a great deal of nutrients or calories to convert to energy. This is normal, but it is very difficult to accept. And it's during this time that your loved one is going to need your love and compassion the most. If you haven't caught up on any of my other videos in this series, or one of my other videos related to dementia, check them out over here. And be sure to check back every couple of weeks for more of this video series. Thanks for watching, and until next time, good luck cracking the code.